Imagine carrying a child for decades, but never giving birth. Imagine a fetus slowly hardening inside the body, not decomposing, not growing, but turning to stone. This is not a myth. It is not folklore. It is one of the rarest, strangest, and most unsettling medical conditions in human history. Today we are diving deep into the world of Lithopedion, better known as the stone baby. A phenomenon where a pregnancy, instead of ending in birth or miscarriage, calcifies and becomes a permanent part of the mother's body. This story is part science, part tragedy, and part sheer horror. So buckle in, because this one is unforgettable. Lithopedion comes from Greek, lithos meaning stone, and paidion meaning child. Quite literally, stone child. It occurs when a fetus dies during pregnancy, usually outside the uterus in what's called an abdominal ectopic pregnancy, and the mother's body cannot expel it. Instead, the body does something remarkable. It protects itself. The fetus, left inside, becomes a threat. Decomposing tissue could cause infection, even death. So the body calcifies it, wrapping it in layers of calcium salts. Over time, the fetus essentially turns to stone, becoming a permanent relic of a pregnancy that never reached completion. And here's the most haunting part. Many women live their entire lives with a stone baby inside them, often without even knowing. Stone babies are extraordinarily rare. Fewer than 300 documented cases exist in medical history, stretching back centuries. The first known written description dates back to the 10th century, but it's likely the condition existed long before medical science had a name for it. Even in modern times, with ultrasounds and surgical interventions, new cases occasionally surface. Often when a woman in her 70s or 80s goes to the hospital for abdominal pain, only to discover a calcified fetus that had been inside her for half a lifetime. Think about that. Decades of carrying a child she never even knew was there. Now let's break down exactly how a stone baby forms. This condition is primarily found in cases of ectopic pregnancy. The fertilized egg implants outside the uterus, often in the fallopian tube, abdominal cavity, or cervix. Because it cannot grow properly, the fetus dies, usually within the first trimester. Normally, tissue would break down and either be absorbed or expelled, but if the fetus is too large, the body can't remove it. To protect against infection, the immune system begins encasing the fetus in calcium. Gradually, layer by layer, the tissue hardens until the fetus resembles a fossilized relic. It's essentially the body turning tragedy into survival, and it can remain hidden for decades, discovered only by accident. Let's step into history, because the case reports are both fascinating and heartbreaking. One of the earliest known reports comes from Cologne, Germany, in 1582. The case described a 68-year-old woman who had carried a stone baby for over 30 years. The fetus was found during an autopsy, astonishing doctors of the Renaissance. In France, 1586, a woman known as Madame Chatry carried a calcified fetus for 28 years. Her case was so famous it was written into early medical texts. A case in Scotland in 1813 described by Dr. William Montgomery involved a woman who believed she had been pregnant 46 years earlier. After death, a stone baby was discovered, perfectly preserved in her abdomen. Perhaps the most famous modern case happened in Morocco in 1955. Zahra Aboutalib, a Moroccan woman, went into labor but never delivered. She lived in pain for decades, convinced childbirth was a death sentence after witnessing another woman die in surgery. Decades later, at the age of 75, she went to the hospital. Doctors discovered she had been carrying a Lithopedion for over 46 years. The fetus was surgically removed, calcified, shrunken, and eerily intact. These cases are not just medical curiosities. They are stories of women who lived entire lives carrying silent burdens, often in cultures where pregnancy complications were cloaked in shame or secrecy. Before modern medicine, the idea of a stone child sounded like something supernatural. In European folklore, women who carried stone babies were sometimes whispered about as cursed or punished by God. In some African traditions, calcified fetuses were interpreted as magical, either a divine sign or evidence of witchcraft. In rural communities, abdominal swellings that never led to childbirth fueled superstition about hidden pregnancies, demons, or even unborn spirits. These beliefs shaped how women experienced the condition, often in silence, often without medical care, and often carrying their stone child to the grave. With modern imaging technology, CT scans, MRIs, and ultrasounds, Lithopedion is easier to identify. But here's the chilling fact. Cases still appear in hospitals around the world. In Chile in 2000, an 84-year-old woman was found to be carrying a stone baby for more than 50 years. In India, in 2013, doctors discovered a 60-year-old woman had unknowingly carried a calcified fetus for 36 years. In China, in 2018, an 84-year-old woman shocked doctors when scans revealed a Lithopedion nearly 6 decades old. These aren't isolated incidents from the past. They are reminders that stone babies remain a rare but real medical phenomenon. It's easy to focus on the medical strangeness, but we can't forget the human element. For the women who experienced this, Lithopedion wasn't just a curiosity. It was a lost child, a pregnancy that never became alive. Imagine carrying a reminder of that loss inside you for decades without even knowing. Or worse, knowing but being too afraid to seek help. Some women described feelings of being haunted by the child they never had. Others carried on, unaware, only to discover in old age that their bodies had secretly entombed a pregnancy from long ago. There's tragedy here, but also a strange resilience. The human body protecting itself in the face of sorrow. So why talk about Lithopedion today? Because it sits at the intersection of medicine, history, and human experience. It shows us how the body can adapt in ways both miraculous and unsettling. It reminds us how far medical science has come, and how much suffering once went unexplained. And it forces us to confront something deeply human. Pregnancy is fragile, life is fragile, and sometimes the stories hidden in our bodies are stranger than anything we could invent. The stone baby is a chilling medical mystery, part tragedy, part survival mechanism, part fossilized reminder of life that never came to be. It is one of the rarest conditions on Earth, yet it has been with humanity for centuries. From whispered folklore to modern medical reports, Lithopedion tells us about the strength of women, the strangeness of biology, and the way the human body can turn sorrow into stone. So the next time someone says the phrase, stranger than fiction, remember this. Some mothers carry their children, not for 9 months, but for 50 years. If you found this journey into the world of stone babies as fascinating and haunting as I did, make sure to like this video, subscribe to Dr. Pox's Medical Mysteries, and ring the bell so you don't miss our next deep dive into the weirdest corners of medicine and science. And tell me in the comments, what do you think about Lithopedion? Is it a tragic story of lost children, or a powerful symbol of survival? Thanks for watching. This is Dr. Pox, where the truth is stranger than fiction.